Hi, come with me as an international student from Southeastern Finland University of Applied Sciences to Scotland for an exchange program at the University of Dundee. I had this opportunity from a lecturer in my university who is in charge of students who wants to go abroad. So we had a meeting, and these are the documents I prepared for my visa processing as an international student after the meeting. So I went to UK visa and immigration site to apply for a visitor's visa because my exchange program was in the space of 3 months, which I don't need a student visa, but a visitor's visa will be okay. So I applied my visa and I was directed to a third party, which is VFS Global in Finland. I applied for a standard visitor's visa and my visa came out within a period of 15 working days. So this is the day that I went for my visa in Helsinki, the VFS Global office. And here I am. I was very happy because I had a positive decision. I came home prepared and traveled the weekend that I got my visa. So I ordered for a taxi. I left Finland in April. That was 14th of April and it was still snowing. That's how cold Finland is, but it's a very nice country. So I took a fast train from Kouvola, where I live, to Helsinki, that's the capital of Finland, to board my plane to Edinburgh. So this is me at a place called Tikurila, where I'll get a train from Tikurila to Lento Asema, that's the airport. I finally arrived at the airport, and trust me, there were a lot of people traveling that day. Welcome to Helsinki Airport, which is in Vanta. And when I got to the airport, the first thing I did was to find a forex to exchange some euros to pounds because I will need it for transportation. So I checked in my bags and on my way to all gates that leads to various destinations. So this is Finland Duty Free Shop. I passed through and got some few things for myself before heading towards my boarding gates. A little tour of the airport before I get to my boarding gate. Then finally we're here. I flew with Finnair from Finland to Edinburgh, and I got to my boarding gate on time, and I waited approximately like 5 to 6 minutes, and my group was called to board. I'm finally on the plane, and I have with me Finnish favorite. They call it pulla. After some few hours, I arrived in Edinburgh, and you can see from the pictures and attire on the wall, you can tell I'm in Scotland. And at the airport, you can get buses going to Dundee, Perth, Aberdeen, and my first protocol placement was in Perth Royal Infirmary. So we went to Perth, and when we got there, our keys was ready, and we were led by the porter to our rooms. And this is how the hospital residence for nurses looks like. And at this point, I came to meet my other colleagues who came to Perth before I arrived. So, yes, and the next day we visited the university for our orientation, and I got to know Dundee is the Scottish University of the Year 2025, and this is the School of Nursing. That's my department. And after the orientation, we were given uniforms. So if you're thinking of going on an exchange, don't think of what to wear because you'll be given a uniform from the university that you take to your workplace during your practice. So this was me during the fitting. I was given a large uniform and I was like, this is not my size. It's too big for me. So this is how the uniform looks like. It has the name of the school, the university. That's the University of Dundee. And this the second day, we were given a tour to the school and we went to an office to get our student ID and to do our verification. And here is my other colleague, Folake, and a supervisor from the university, that's Bill. And this is where we are going to have verification done. So during your verification, you will need your passport and your student ID. So we were three in all, and we sat and waited for each one to be called to go through the verification process. And at this point, we were having a chat with Bill, asking a lot about the school. After the verification process, we were given free SIM cards and other souvenirs from the school, including a tote bag, a cap, markers, pen, and other stuff. I don't really remember. And our first day at work. So we have our student ID and we are working our uniform from the University of Dundee. So our first day we went to the day surgery in Perth Royal Infirmary because my first placement was in the theatre and I was given a locker with my name. I was very pleased with this one because sometimes when you go for practicals, it's difficult where to keep your things. And my first day, I was given some books to read to prepare myself for the ward. So I was given books like Anesthesia, the Complete Recovery Room book. So I prepped myself by reading these materials that were provided the first day at work and prepared myself for the next day because the actual work started the next day. So I had orientation on the ward as well, and I was told to clean and make my working area safe before the day starts. And by so doing, you clean surfaces, you clean trays, you clean your trolleys, and this help to prevent infection, especially hospital acquired infection, both for patient and the nurse as well. And also, we had a checklist that you have to go through every morning to check all your suppliers that you need for your work are available and they are enough. And you have to also check when some suppliers were open and if there is the need for you to replace it. Also, you have to indicate a date when you open a new hospital suppliers. And this was my first stage scrubbing. You can see me in the theater. I had my mask on. I couldn't do much in the theater because it's not allowed to take photographs, videos, and anything of that sort. Here you can see a happy student after successfully scrubbing during various surgeries and receiving patients into the recovery units. I dressed like this during a transurethral resection of the prostate and tent section where they use X-ray and laser for treatment and you need this for protection. I was also given logins that gave me legal access to read patient background information and know their treatment plan. I also did documentation which facilitated handing over the patient to the ward and ensuring continuity of care. Patient consent was sought during every procedure. Privacy and confidentiality was ensured. I had opportunity to witness surgical procedures in the urological theater, the gynecological theater, the general theater, and the orthopedic theater. I'm very grateful to all the staffs and Perth Royal Infirmary, the theater to be precise. From Perth Royal, my next practical placement was in Nine Wells Hospital in Dundee, which I was assigned to Ward 19, that's the orthopedic ward, which is both for pre-operative and post-operative care. I saw post-operative procedures like below knee amputation, pubic rami, total knee replacement, hemi and total replacement of the hip. I learned how to use some assistive devices that aid in mobility after surgical procedures like the Star Study, the Zimmer frame, the walking stick, and among others. I did extracurricular activities like visiting the Perth Museum, going to the farm with my colleagues, having a lot of fun activities, and also we visited the Rodney Park, which is located in Perth. It had a lot of beautiful flowers. It's a beautiful scenery that has this calm and steady atmosphere that it's good for relaxation. I took a picture with my colleague Folake, and here we had a hangout dinner with the nurses from Perth Royal Infirmary. We made connections, we made friends. I really had a nice time in Scotland. I went for shopping in Primark, other stores, and I was able to visit the beautiful city of Glasgow. I would like to thank my teachers and supervisors from the hosting university and also nurses from Perth Royal Infirmary and Nine Wells and other people that made Scotland a beautiful place for us to live. Thank you.